Hello, everyone, and welcome back to the Diverse Thinking, Different Learning podcast. I'm your host, Dr. Karen Wilson. Now, it may surprise you to hear that most children diagnosed with ADHD are given medication, offered some counseling, and nothing else. Well, pediatrician Dr. Hokehe Eko wants to change that. What she has found in her practice is that it's not just about treating behavior symptoms. It's about looking at the child as a whole person and recognizing the multitude of factors that can affect behavior. Dr. Eko is a mom, board-certified pediatrician, TEDx speaker, and CEO of Glow Pediatrics. She partners with parents of children with ADHD and autism to address the root causes of their children's behaviors so they glow with health from the inside out.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Hello, Dr. Eko.
Hi, Dr. Wilson. Such a pleasure to be with you here.
I am so thrilled. I feel like I know you. This is like the first time we're seeing each other, but
I know.
I've been following you on LinkedIn, and like I told you, I've watched your TED Talk, and so much of what you say about the kiddos that we work with resonates with me, and the way and your approach to understanding ADHD and neurodiversity is just, I just embrace it wholeheartedly, and I wanted to have you here. So I'm so glad to have you here.
Yes, thank you. It's an honor, and thank you for those kind words. I accept them. That's really nice of you. Thank you.
And congratulations on launching your podcast, Brain Power. I will definitely put a link to that podcast in the show notes.
Thank you. Yes.
So you are a pediatrician. You are the founder of Glow Pediatrics and a big advocate for empowering our brains, which control all that we do. I just did an interview with Dr. John Rady about the impact of exercise on the brain. And again, we're looking at lifestyle changes that can make a big difference. And you talk about that. You work with families who have autistic kids and kids with ADHD, and you really have a different approach. You really look at the whole child. A lot of people say they do, but you really look at the whole child, the whole family, and the community.
Right.
And I would love for you to talk about how you came to having that approach to working with families.
Yes, thank you. That's a great question. Should I give you the long answer or the short answer?
Give us whichever answer you want.
Okay. So yes, and as Dr. Wilson said, I was a general pediatrician until a few years ago, and really, what did it for me was just a series of we started having training at work for child abuse, because in the state of Oklahoma, there's one or two in the entire state. So they wanted to empower general pediatricians in the community to be able to help decipher what was going on with the child in terms of abuse. And so it was during that time my eyes were open to really what trauma does to the child and how the children may react differently. And then I had a chance to meet one of my little friends, as I call them. And this was names and ages change, of course, but he was a 4-year-old little boy and was brought into my office by a foster care worker and told me he has ADHD and he needed meds. And so, of course, I'm like, he's 4. I don't do 4-year-olds and ADHD diagnosis. Those two things don't usually go together, at least for a general pediatrician. So I said, well, tell me more about what's going on. So it turns out he had just been traumatized at his last home, has just been abused at his last home. And so in my office, I noticed that this child was bouncing off the walls. Yes, I agree. He would run to each wall. But then I also noticed that he gave me a hug each time he would run to each wall. So I got at least 15 hugs from like a 10, 15-minute visit. And I usually don't get that many hugs from kids. So I took note of that and I heard myself saying to the worker, find him a loving home and then let me see him again in a few months. And
Right.
I too was like, what did I just say? How does that even make sense? Where did I pull that out of? I don't know if it was the mother and me or just because I don't know, just the hugs made me think, there's something else going on here. Do you know, when I saw this child again 6 weeks later, this child was sitting on the laps of this foster dad who he was calling Papa and gave me one hug. And there was no jumping up and down. There was no hitting walls, nothing. I was like, what just happened? And this is a known foster dad who's really loving. And I was like, oh my goodness. So that means that trauma can make changes in the way our brains work and actually make changes in our behavior. And if you provide the loving support and loving environment, it can actually heal the child's behavior. Because if I didn't see thank God, if I didn't put those dots together, I would have put him on stimulant or found somebody to put him on stimulant, right? And we would never have addressed anything else, the underlying issue. So that's what got me started thinking there's more to this than just medicine. There's more to... And then the ACEs study came out. It was about that time we all started hearing about ACEs that we didn't get trained on. And I was like, how nobody said anything
This
like
missing
this?
piece, right?
Right. And then the more kids in my practice, I started like asking the questions and I'm like, oh my goodness. And then, for example, this child that came in and said, mom said she's hyperactive and she's 12. I talk about her in my TEDx talk. And then I asked the question about her house. And then mom says to me, Mom, doctor, everybody thinks I'm crazy because the minute me and my daughter walk in our house, we feel sick. Even the dog goes into their house and will lay down. And insects will die when they fly into the house. I was like, so can you please not take my patient back into that house? She said, sure. I was like, can you, Mom, not go back? She's like, well, she had to. So she took her daughter to her sister's house. And I am telling you, within 6 to 12 weeks, when I saw this child again, this child was no longer hyperactive. Then it turns out it was black mold. So then I was like, oh, wait, hold on. So there's all these environmental things that can mimic hyperactivity. And if we're not asking, I would have put that kid on stimulant and not asked the question. And she will be worse, actually, because if she keeps being exposed, the damage will only get worse. And so that's what led me on the path to I need to find out more. And so I did the additional training in integrative medicine for pediatrics, just so I could understand how to really address all the layers of the child, not just the symptoms.
Absolutely. And that's why it's so important, to dig deeper. It's like when people say, I need an ADHD evaluation. And I say, you can never just assess for ADHD symptoms because those symptoms occur in a context. And you have to look at what are the reasons why the child is behaving that way or exhibiting these symptoms. Because if you don't know the reason why, and I say this all the time, you don't know how to intervene. Right. If it may not be ADHD, like you're saying, in those two cases, in those examples that you gave, the symptoms were similar to ADHD, but it wasn't. Right. And we see that with anxiety and depression as well, where, they think they can't focus, they're forgetful, they don't have motivation to do things. And then you look deeper and it's anxiety and depression and it's not ADHD.
Right.
And so I love that approach. And I think it's essential. It's necessary. It should be the standard of care.
Yes.
And for those kids with ADHD, and you say this in your TED Talk, according to the Centers for Disease Control, when an individual is diagnosed with ADHD, 77% are offered medication and counseling, only those two things. And we know that medication does not address all the challenges that students who actually have ADHD face. And parents have said they were told by their kids, teachers, that they would get kicked out of school. You talk about this if they didn't put their kids on medication. I have seen that in my practice.
Yes.
Now, you and I are big advocates of lifestyle changes to address ADHD symptoms. Right. So for those kiddos and those families where it's not black mold and we've ruled out trauma, still, medication alone is not enough. I'd love for you to talk about some of the ways that you believe and that families can support kids and their developing brains in addition to medication if that's needed, and sometimes instead of medication.
Yes. So yes, that's an important question. Thank you for that. As I said, I also said this in my TEDx talk that there's mainstream research. Research done by the NIH, research done by it's listed on PubMed, that there are nutritional deficiencies in children with ADHD. And so if we don't ask the question, so something as simple as low vitamin D, right? We all know that low vitamin D will affect mood. How about we start checking kids' low vitamin D levels? Because if the ones I've checked, they're like super low, and we bump it up and their mood improves. Now, I'm not saying they don't have ADHD, but I'm saying let's look at all I call them simple because they're things that we can easily address. Let's check their anemia level, their iron storage levels, right? Because iron helps with red blood cell formation, which carries oxygen, which the brain needs the most oxygen in the body. So if we're not feeding the brain enough oxygen, so of course your brain is not going to function well. So that's a simple test any pediatrician can do. Check the iron stores, like the ferritin levels. Check the vitamin D levels. Is the child low on zinc? That's an important mineral for the function of the brain. So there's research, we know this, but it's not part of what we do, right? We mostly will give the questionnaire and start meds. But my thing is, I'm not against meds. I just want us to address all these other things that we can. Even if we have to start meds, fine, but at least address the things that are easier to address, right? And that will definitely make a difference in the child. Because if their vitamin D levels are low, that will affect their sleep. And we already know that we could as well call ADHD the sleep disorder, because if the child doesn't sleep, there is no way they're going to act properly. Take out ADHD, any child, right? Even any adult. So it's so critical for us to address the sleep, address what they're eating, address the nutritional deficiencies we know are present. And that's treating the whole child. If there are any issues in the environment, address that as well. How much water is this child drinking? Something as simple as that, right? We know the brain needs the most water in the body. How can we incentivize our children, starting with the parents? Because if the parents, I tell parents, if you make it like a challenge for your entire family, then all of you get healthier together. You'll find that your brain functions well. And so if we are feeding the brain what the brain needs and the brain loves, we're going to see the difference in behavior. And that's where the whole concept of the thing I talk about, brain falling in love with the health of your brain. Because if we do that, and whatever we are doing, we look at it from that lens, then we are more likely to do the right things for our brains that we can control, right? Within control.
Right.
Yeah.
And I think a lot of people want a quick fix, right? and especially for parents who've been dealing with these behaviors for a long period of time and it's causing struggles in the home. I can understand that. But, we've talked about so many of these different pieces that you've mentioned. We've talked about sleep. We've talked about exercise. And I think a lot of people might be surprised to know that nutritional deficiencies can also either cause or exacerbate ADHD symptomatology, ADHD symptoms. And like you said, that's a quick fix. That's something that a panel that seems like your pediatrician, your family doctor can run to determine if that's an issue and then address it. And then you come back like the children you talked about with the trauma and the mold, and you can see if it makes a difference before you make the decision to start medication.
Right. Yeah. I have parents who are insistent on starting the meds regardless, which I explain to them, but I have done it, but I also just try to encourage them. I understand the behaviors are difficult, but really the medicine will last till what time? 4 p.m., 3 p.m., and then we're back to the same behavior. So how about we address everything concerning your child, at least the major areas, so that way, even if we're on medicine, we're going to see a change in the overall health of the child. So,
right.
Yeah.
And it seems like I'm hearing four main areas. Definitely sleep. And we can talk about how important that is. Nutrition, water, make sure you're getting enough water. And then of course, exercise, right? Those areas together. And are there things that parents can do? And what struck me was that example that you gave about the child who came into your office with the 15 hugs. It was clear, and in my mind, as you're describing, I'm thinking he wants connection. He's longing for some form of a connection, right? And not having it is contributing to either distress or stress and leading to some of those behaviors that you saw.
Right.
Are there things that parents can do?
Yes, definitely. And before I address what parents can do, important piece of that story I didn't mention was that he had been in 10 foster homes in 6 months. Yeah. So my question I always ask is, if that had happened to you, you've been in 10 strangers' homes and you're only 4 years old, what would your behavior be like? You'd either be on that end of the spectrum, like being hyperactive, or you wouldn't even talk at all. I mean, it's like that alone is traumatic, right? Besides, I mean, outside of any abuse. Yeah. And then also in terms of what parents can do. So it's one step at a time. We don't want to overwhelm you, but if you take an area like, for example, constipation, which of course addresses the nutrition, is a big area, right? Most kids with ADHD, autism are constipated, and it's because of what they're eating, right? And the way I look at constipation from an integrative lens is because the body is not functioning the way it should, right? And it's all backed up with what should have been removed from the body. That causes an inflammatory response in your gut. And so once your gut is inflamed, your brain is next. I mean, the two things are connected. So your inflamed gut your brain is going to be inflamed as well. And in addition, the things we eat often inflame our brain, right? Which is why you see that the kids only want to eat a specific thing. It's like they're addicted to those few things, and that's all they're going to eat. But those few things often are so highly processed that it's causing an inflammatory response. And so the thing I like to tell parents, okay, let's take out one of those foods. So for example, instead of drinking, a lot of the kids like to drink a lot of milk, right? And they don't often digest the dairy well. So how about we just start doing half and half, like almond milk, oat milk, until we get off of dairy, and let's just give the tummy some rest from the dairy, because dairy by itself constipates, right? So if we can take away something we know that's constipating and is aggravating the constipation, and then slowly replace it over time, you should see a difference. And then increase water intake, right? Decrease the milk intake depending on the age of the child, and then add in the vitamins that they need. You should see a difference. I mean, I have a story. I saw a kid a few weeks ago, 4-year-old, came for an ADHD eval, and I, of course, told mom I don't do ADHD diagnosis in kids that are 4. So I said, okay, what else is going on? So I also all the systems questions and all of that. So it turns out this child was drinking chocolate milk in the middle of the night. He also didn't sleep well. He also was hyperactive at school. So I said to mom, and he of course is constipated. So we have these things going on. The sleep is off, constipation, tummy is not functioning well, not sleeping well, not acting well. So I suggested to mom, okay, so first of all, he's 4. He doesn't need to be drinking anything in the middle of the night. That's one. So how about we swap out the chocolate milk? I actually just stop giving it to him, right? And if he asks for something, absolutely, the only thing you're going to give him is water. And so she agreed to do that. And then we swapped to oat milk or almond milk. I can't remember which one of those. And then she also made some modifications around sleep, like took out all the electronics from his room because of all the rays being emitted that would decrease melatonin, and it's a cycle. So she did those few tweaks, and I saw the kid a month later. A child is no longer hyperactive. I was like, so what happened? She's like, oh, he stopped drinking chocolate milk. He's now poops and he's actually sleeps all night. Oh.
Oh my goodness.
So I'm not in any way saying there's nothing like ADHD. There is, but wow. I was like so happy that day at work. I was like, another good story. It always makes me so happy that just a few changes can make such a difference in a child and the whole family. Because he would wake up in the middle of the night, drink the chocolate milk, and then go to the parents' room, and then that was the end of their sleep. He's not sleeping either. So it's like the whole family. My thing is the whole family approach. If we can help your child get better, then your whole family will do better.
And this really speaks to the idea that environment plays such a significant role in a child's behavior and overall well-being.
Yes.
And we know from the research on resilience that even just having one caregiver who is modeling those good behaviors, those positive behaviors, but who also establishes a close connection with the child can make a significant difference in their lives. I'm thinking about the child who went into foster care with that gentleman and how that changed his outlook and his experience and his behavior. And so all of these things are so easy to do, but hard to implement for so many families. Right. In theory, it's like, oh, I just need to get more exercise, make sure my kid's getting enough sleep, make sure they're eating a nutritious meal. And then I think in the thick of it, when you come home from work and you've got a lot of things on your plate and your child says, I just want nuggets and Kraft dinner, right. Like, okay, fine. What I mean?
I know. I hear you. I have 3 kids. Yes. Yesterday night, I was like, can somebody cook me dinner? So I definitely hear you on that one. And like I said, it's a process. I always, when I talk to parents, I go one thing at a time. What's the one thing we're going to change? And the next time is the one thing. It's the one thing. And all the small successes add up to a child that's overall health is improved. So please don't be overwhelmed. Just pick one thing. Say we're going to drink we're going to drink 1 extra glass of water as a family this week. That's it.
Right. And now they have those jugs of water that keep track of how much you have with so you can turn it into a contest and make it fun, like you were saying before, correct?
Yeah.
And it is just small steps. It's like we should have a salad with dinner every night. And you are going to have a vegetable in your lunch for every lunch that I give you. We can't guarantee they're going to eat it, but it's going to be in your lunchbox.
Right? Yes. Yeah. So small things like that. And then, if you say, for the parents that will say their kids don't drink water, and I've heard that so much. Okay, instead, don't buy the packets, the flavor packets, because if you think about it, that's chemicals. And our goal here is to decrease the chemical load for your child because it's affecting their developing brain. So instead of that, cut up some slices of apple, put it in the water, stick it in your fridge. In 30 minutes or less, your water will taste like apple without any extra anything. And make it fun. Let the kids pick out the fruits they want to flavor their water with. And they'll be more likely to drink it because when you get kids involved in things, they're more likely to take on ownership and actually do it, right? So we can make a contest of whose flavored water tastes the best and what fruits work. And actually, they have the bottles with the infuser in the middle, so you can just. So just for that one thing, I mean, you've made it fun. Your family bond has strengthened because now the whole family is doing it together. And I mean, there's nothing like that. And you see so many positive returns from just doing things as a family. That's why I encourage parents, whatever changes I'm making, we're not pointing fingers at the child. The whole family needs to do it because I had to do the same thing. I'll tell a quick story. My daughter's lips started turning black, like jet black from pink. And I had no idea what was going on. So of course I took her to dermatology and they were like, we have no idea. And then I took her to the allergist, and they were like, she has no allergies. But that's the part that made me upset because she had allergic shiners. She had all the things under her eyes, the darkening, all the usual signs of allergies, but her tests were all negative. So I was like, what in the world is going on with my child? So of course I started to dig and dig and dig. And then that was about the time I was finding out all these different things about trauma and the brain, and then I found this blood. I came across this blood test I could do at home. It was an IgG blood test. I did it. Oh my goodness! Turns out my daughter was sensitive to gluten, dairy, eggs, cashew, pineapple. So, you know what? Of course, I pulled all of that from our house. The entire family went gluten-free, dairy-free, egg-free. And
Oh my
of course,
goodness.
it wasn't pretty, or, I mean, I did it I just pulled everything. I could have done a process, but I was like, I have no time for this. I need to fix this right now.
We have to do it now.
So, but do you know, in 8 weeks, her lips were back to pink.
Interesting.
So that's when I was like, oh, wait, food plays such a big part, because food, if you're eating the wrong things and then you start to see evidence on your skin, is an indication that something's off in your tummy, in your gut, because that's where most things start, right? It's the inflammation that's going on because she was eating the wrong things. And so I didn't bother testing any of us. But now when I eat something that has gluten in it, my tummy hurts. And I was like, oh, I didn't know that before. I mean, I used to eat it all the time and nothing, but now I've taken it out of my diet. I can feel the difference. So I say that all that to say, if you it's a process and you just go through it one day at a time, and do it as a family. I think that's why I brought that story up. If you do it as a family, and so now everybody is on board by force. But you don't have to do it my way.
But you did it. You either go ahead and do it, you're all in, or you choose the process route, right? But what I'm hearing is that, when kids are struggling with their behavior, and it may be related to ADHD, it may not be, but you want to find out for sure what it is, because again, the intervention has to match the reason why they're struggling. There are things that we can do as a family, as members of a family, to support children who are struggling. And the other thing you talk about, and I know that there's so much to say, but it's really important to also, when kids are struggling behaviorally, to establish partnerships with educators and those who provide educational support. And I think about kids who have executive functioning issues, many of them are struggling with executive functioning, and the medication is not going to fix that. The organization and the planning and the, how to manage the homework demands. And so all of that has to happen as well. It's all of the things we've talked about, plus establishing partnerships. Do you talk to parents about that as well?
Yes, absolutely. That's critical. I've had to do it as a parent. I have a daughter who struggles with executive function skills, and I found a wonderful educator, Dr. Bell, and actually I formed a partnership with her to help the kids I see, because she did such a fantastic job with my daughter, Dr. Bell of Grace Space Consulting, that now we work together to help children. Because I discovered it's not enough to do the medicine, or it's not enough to do the nutritional modifications. We also need to address directly the skills, like you said, that they're lacking. So it's absolutely critical. And for parents who don't have access to an executive function consultant, talk to your teachers. Don't wait till parents-teacher time. Check in with them. Go have candid conversations. Ask them questions. They spend a lot of time with your children, right? And they often have suggestions that will help you, if you implement them at home, to strengthen those skills that your kids need. But for sure, it's critical, because we can't do this by ourselves. We need the village support to get our children in one piece, right? Shouldn't say in one piece, to the best version of themselves. Really, that's what it is about. Because we accept our children where they are, who they are, but we want the best version of themselves. And it's critical to collaborate with their teachers, to collaborate with their doctors, to ask questions, keep asking questions, because that's what I've had to do as a parent. And that's how I've gotten to where I am, because I kept asking, but why? But why is this not working? And don't think your question. I always tell parents, there's no stupid question. It's always better to ask if you're not sure about something and a way to help your child, or ask, and that's how you get help. So yes.
And again, that integrative that whole brain approach, the family, the community, educators, educational support, they're all critical. And then also conveying to our kids that it is important. And you often talk about helping kids understand their brains, which I think is absolutely important. And then loving the brains that they have, and then connecting all of the things we talk about, having a good diet and getting exercise and getting enough sleep and managing our screen time and getting support from educators when we need to. All these things help to enhance our brain health. And we have to not be shy about sharing how these things impact our kids with them so that they can get on board as well.
Yes, absolutely. Because your kids are soaking up knowledge, and so don't feel like they're too little. I mean, if they're little, break it down to a level they can understand, but they're more likely to be on board with whatever changes you need to make if you have a discussion with them. And you'll be amazed the memories that they carry of that, and they just feel like their bond with their parents is so much stronger because daddy trusted or mommy trusted me enough to explain to me what's going on with me. So that way they too can accept themselves for who they are, because you also want to strengthen the identity of themselves. Because if not, the world, everybody else is going to tell them who they are, and they need to know who they are. Nobody is perfect. Everybody has things we're working on. So if you help your child accept who they are, first by accepting your child, then your child will be the best version of themselves. So,
every child needs a champion. And I feel like, Dr. Eko, you are that champion. Thank you so much for being here. I know I'm going to have you back because I have tons of other questions to ask you and things that we can talk about. What is the best way for our listeners to connect with you if they'd like to learn more about this whole brain, whole body, whole family approach?
Okay. So yes, my podcast is called Brain Power with Dr. Eko. Everywhere podcasts are listened to. My website, my practice is Glow Pediatrics. And the website is www.glowpediatrics.com. And on there, I have blogs. There's a number. If you would like to get in touch with me to work with you and your child, please call the office number. It's on there as well. I'm sure I'll give it to you. You can put it in the show notes as well. I have a group program called Glow Brain Health Circle, where I have weekly classes with parents as a support group to just walk through how can they really help their children thrive. And it's open to anybody nationwide, really. And it's not just, I call it a circle because it's a place for community. And it's not just me in there. It's me, the integrative doctor. There's the executive function consultant. There's a therapist, because I think we all need therapy, but that's another conversation. And there's a nutritionist. So we are addressing all the different areas so that parents can feel empowered to be able to help their children at home. I also do one-on-one consults, but all of that information can be found on my website. I also have a book, if it's okay for me to talk about.
Yes, please do.
It's called Children's Love Letters. And it's also on my website and also on Amazon. So it's a pediatrician's guide to how your child spells love.
Because, oh my goodness.
Yeah. I wanted to just, it's something that came up with my 3 kids, and I just expounded on it just to help parents understand the different ways children spell love. More than just time, like we usually say. Yes. So
right. I think I might have to have you come back just to talk about that book. So,
okay. Yeah. I'll be happy
we'll definitely do
yes.
that. Wonderful.
And of course, I'm on Facebook and IG as Dr. Eko, and Facebook as Dr. Eko, and LinkedIn as well. So all the places.
Yes. And I will put all of that information in the show notes for sure. Thank you again for being here. It's been such a pleasure.
Yes, same here. Thank you for having me.
Thank you so much for joining me today. Be sure to check out the show notes to learn more about Dr. Eko. She's also the CEO of Kids of Hope, a 501(c) organization that shares love, hope, and dignity for children in foster care. Thanks again for listening, and I'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.